I am Dr. Upendra Kaul, Chairman of Batra Heart Center, interested in diseases of heart and all the associated problems including diabetes and high blood pressure. Well, today we are going to talk about diabetes and especially diabetes in elderly people. Diabetes is a very common problem in our country. In fact, India is also called as the capital of diabetes of the world. That is because we have at least 70 million patients suffering from this problem in our country, and this is the total number of people is much more than the population of many countries. That is the mind-boggling number here. Every third or fourth person you meet after the age of 30 to 35, if you check them, they have high blood pressure. And that is the reason we also have a lot of heart disease and strokes in this country, because diabetes is a very important risk factor for vascular problems. Now, the diagnosis of diabetes very often is made quite late in our population, because it is very often does not have any very specific symptoms. These people sometimes feel that they are just aging, and some of the symptoms like confusion, dizziness, weakness, fatigue, some mild shortness of breath are all symptoms of aging, and many of them just get reconciled with this and feel that it is a part of life. Whereas some of them, this problem is diagnosed when they have a major complication, like they come with a heart attack and the blood sugar is done, it is quite high, or they present with some infections which is not getting under control easily. Blood profile is done and you find here the person is a diabetic. Often a urinary infection which is again taking time to respond, and then you find that person is a diabetic. And some injury occurs, and the ulcer which forms at the site of injury is not healing. It's taking too much of time to heal. Once again, then the doctor tests the person completely, blood profile, and he's a diabetic. So diabetes can present in a very diverse form. Sometimes it is diagnosed incidentally. Sometimes you suspect it when the person comes with a complication. So it's extremely important for our population to have at least one examination of blood sugar done at least once in a year. And if it is kind of borderline, that is the fasting sugar is coming like 120, 125, or a random sugar sample is coming around 160, 180, it's always good to repeat it at a shorter interval so that you pick up diabetes early. Because if we pick it up early, we manage it early, we then get less complications of diabetes, and then we live longer, we live in a healthier condition and don't get into all the major problems.